So imagine feeling isolated, like your life is being taken over by painful and debilitating symptoms. Well, this is what it can be like for people with acute hepatic porphyria, or AHP. It's a family of rare genetic diseases characterized by potentially life-threatening attacks. Joining me today is Porphyria specialist Dr. Bruce Wang of the University of California at San Francisco's Porphyria Center and Consortium, and Mary, who's been living with this condition for the past 20 years. Welcome to the show.
Thank you.
Thank you.
Thank you very much. I appreciate you both joining me. I've never heard of acute hepatic porphyria. Dr. Wang, what is it?
Well, so the porphyrias are a group of rare diseases, and most people, including physicians, oftentimes have not heard of the disease. It primarily affects women during their reproductive years, and it presents with severe, potentially life-threatening acute episodic attacks of neurologic damage.
And that means?
That means that most often patients present with very severe and generalized abdominal pain, but they can also have other neurologic symptoms like numbness, weakness, fatigue, and even mental status changes.
Wow, the symptoms sound as though they could be mistaken for any number of other illnesses.
That's correct. The symptoms are nonspecific, and they can look like a lot of other more common disorders, which is another reason why this disease is oftentimes missed.
When it presents, do women most often speak with their gynecologist first, and perhaps that's why it's not properly diagnosed?
Well, typically the patients present to the emergency room because the symptoms are so severe that they can't manage the pain and the nausea and the symptoms at home. So most often the initial presentation is to the emergency room, and patients typically have multiple hospitalizations and including several surgeries before they are ultimately diagnosed correctly with acute hepatic porphyrias.
Can it be cured?
It is not a disease that can be cured because it is a genetic disease that the patients inherit mutations from their parents. But it is a disease that can be managed, and it's a disease where the attacks can be successfully treated and even prevented.
How is it managed and treated?
So the management for acute porphyria attacks is twofold. The first one is trying to avoid triggers that can initiate the attacks. And the second is to stop the attacks. And currently there's only one approved treatment in the world, and that is by giving patients purified heme protein through an infusion.
Oh, that's interesting. How long do the benefits of the treatment last?
So a typical treatment to stop an attack lasts between 4 to 5 days with a daily infusion of heme.
Mary, when were you diagnosed?
22 years ago.
And what did you think when you were going through all of this?
I was perfectly healthy until I got an ear infection and was given a sulfonamide antibiotic. On the 4th day, my fiance came home and found me passed out on the floor. This drug woke up the sleeping dragon, as some of us call porphyria, in my body. It was terrifying. The pain is beyond imagination. Women who have had natural childbirth say that that is nothing compared to a porphyria attack. It's like flaming swords in your stomach, as well as pain throughout the rest of your body, as well as very scary high blood pressure and heart rate. And you go to the ER, you get hospitalized, and they tell you all your tests are perfect. You're a perfectly healthy person according to scans and MRIs, scopes, and all the blood and urine tests. So it's really terrifying because you know there's something wrong with you, and you have doctors telling you again and again that nothing is showing up because they haven't tested for this specific disease.
And ultimately, how were you diagnosed?
I was in the ER. It was my 12th attack in 18 months, and I had given a urine sample, which looked like port wine. A doctor who was not the one treating me walked down the hall and made a joke to the nurses not to drink wine and party in his ER. And I yelled out into the hallway that that was my urine. He came into the room and asked a few questions, asked if I had ever heard about porphyria. And he said, "I think I know what you have." It was just a fluke that he had seen a movie three nights prior that had talked about this disease.
Well, God bless. Dr. Wang, does someone have to count on luck then to be diagnosed?
Well, unfortunately, this disease can take a very long time to be properly diagnosed. In the United States, the time from which a patient initially presents with an acute attack to when they are diagnosed is 12 years. So really, we need our physicians to think about this disease because there is a simple test that accurately diagnoses it.
What's the name of that test?
So it's a urine test for a chemical porphobilinogen that can easily be checked in anyone.
Wow, Mary, I feel for all the women out there who might have this and are undiagnosed. Does this just affect women, or can men also be affected?
Men can also be affected, but with women like me, it kicks into our menstrual cycle and we get attacks after our progesterone peaks.
It's a disease that primarily affects women. So 9 out of 10 people that have acute attacks are women.
How many people have been diagnosed with porphyria?
It is a rare disease, and we actually don't know exactly how many people are affected. This is part of the reason the National Institute of Health formed the Porphyria Consortium so that we can study the disease better. It's estimated that 1 in 2,000 people carry mutations that put people at risk of developing attacks, but the number of people that actually have acute porphyria attacks may be as low as 1 in 20,000 people.
I'm just speechless, Mary. I want to thank you so very much for sharing your story, because I think, I always say informed is empowered, because if you don't know about something, you certainly can't ask about it, right? And there might be someone out there who's experiencing these very same symptoms and doesn't know, but perhaps this interview will trigger the opportunity for them to speak with their doctor. Thank you so much for sharing your story. Dr. Wang, where can we go for some more information?
So people can go on the website for the American Porphyria Foundation, that's porphyriafoundation.com, as well as from the company Alnylam at alnylamact.com for more information.
I appreciate you both for joining me. Thank you.
Thank you.
Thank you.
And I'll be right back.